What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, May 9th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. Today we're going to talk about several different stories and news stories, and then we are going to take a look at some data and some weekly data that has come in. So if you're new, subscribe down below. If you want to help keep other people safe, share this with anyone you know, and give this a thumbs up down below. The more times you hit that like button down below, the more YouTube will push this content out throughout the algorithm. And if you have something to say, maybe something you see today or something that's on your mind, leave a comment down below. All right, like I said, we do have a few news stories today. We're just a couple, maybe 2 or 3 at the most. And then we're going to take a look at some of our daily data, some weekly data, and we will do a few wastewater sites today as well. First off, a virus we have not talked about in quite some time. Saudi Arabia reports 4 new cases of MERS coronavirus, 2 of which were caused by human-to-human transmission in a hospital. For those who do not know, MERS stands for Middle East Respiratory Syndrome, and MERS is different from COVID and first emerged in 2012. Most cases are linked to camels, so human-to-human transmission in a hospital. That's not a good thing. We'll have to keep an eye on this. It's not the first time that we've talked about it since I've started the channel. Probably won't be the last time. Talking about another virus now. H5N1. Bird flu found at 6 more dairy farms, including 4 in Michigan, and 1 in Idaho, and 1 in Colorado. This raises the total number of outbreaks on dairy farms in the U.S. to 42. And I think this number is going to keep going, and I think it will definitely surpass 50 at some point. All right, moving on to this now. Yet another virus. With 2 chronic wasted disease positive deer, California now becomes the 34th state to report the fatal disease. The disease had probably been in the state for some time, officials say. For those who do not know, chronic wasting disease, it's a problem. It's now in, as you can see, 34 states, and it is a big problem in the Midwest. It's a big problem here in Pennsylvania. We have a lot of management areas where, let me explain what that means is. So if you're a hunter, and say you're hunting in portions of Pennsylvania, there are certain areas that you need to be aware of. They have chronic wasting management areas. So if you're within those boundaries, you're required to have your deer checked out. There are places where you can drop the head off. If you go to the butcher, you can, they're supposed to check. I don't know if all of them actually do, but they're supposed to check for chronic wasting disease. And of course, if your deer is infected by it, sorry, you have to discard it. So that's what happens there. And now we're up to 34 states, and I don't know. Is it going to become all 50 states? It very well could. I mean, it continues to spread. And as we do know, there was one report that a hunter possibly died back in, I believe, 2022. Just one report so far. That's the only human deaths that we know about so far. All right. Wasn't certain if I was going to show this today or not, or just do a whole video on it tomorrow. We still may do a whole video on it tomorrow. This has to do with North Carolina. Republicans in North Carolina Senate, I believe it is, want to propose to ban masks in the state of North Carolina. This was posted on my site today. Guy from North Carolina. How fitting, that's his username. He's posted several things, and he does post great content, and he did share this story, and it says here, North Carolina lawmakers looking to peel back COVID-era provision being used in protests, but as we know, masking, it really became the thing in 2020. It was a big thing, but North Carolina, believe it or not, had an old clause. I believe it goes back to, it's not listed here, but I did read this. I think it was 1953, had an old clause where masks were banned. And then they changed it in 2020 for safety reasons so we could start using these lovely masks. I hope this does not become a thing. If North Carolina passes this, I could see other states that are Republican-led, or maybe it doesn't even matter at this point. I could see other states that doesn't matter the party at this point that come up and say, hey, no more masks. It's something that we're going to really have to keep an eye on, and I hope it does not become the new normal because, let's face it, every person is at a high risk with COVID. I mean, someone could be completely healthy, test positive for COVID, go on to develop long COVID, and suddenly their life gets turned upside down. Wearing a simple mask can help prevent the spread of COVID. All right? We'll talk more about this probably during tomorrow's pandemic update, which, again, it may be out in the wild, it may not be. All right, taking a look at the allergy map, 34% of the country today for pollen levels are in the medium to high status at this time. You can see the highest levels of pollen today are in some of the central states and the upper Midwest and the northern plains. Hey, again, masking's good for pollen. And if we go back real quickly, this does talk about masks being used in public. So, I mean, I guess if you're out in the public and you want to use a mask to prevent pollen, well, if that bill gets passed and you live in North Carolina, that may be a no-go. Totally absurd and ridiculous again. We'll have a whole discussion about that tomorrow. We haven't had a rant in a while. That's a rant-worthy topic. Taking a look here. Air qualities today. Hey, the mask also helps with that bad air qualities. And Texas, once again, has bad air qualities. I need to do some research this evening. Find out why. Do you have wildfires once again? I don't know. I haven't been paying attention lately. Mississippi, Alabama, Louisiana. It would appear if your wind is blowing that direction, look at this. You're having bad air qualities as well. But mind you, there is a big, severe thunderstorm threat down there today. We'll get to that in just a moment. I got to keep you safe from that as well. Taking a look at the Northeast, not too bad. It's just some minor air quality issues in the Mid-Atlantic, near Philadelphia, just west of Philadelphia. Chicago, some minor issues, and not bad on the West Coast today at all. Taking a look at severe weather today. I just want to backtrack for a second and show you something here. There were 757 severe weather reports yesterday. Back in the day, I've been following meteorology for well over, since I was a kid. We'll say 20, 25 years now. There never used to be this many days with 757 reports. It's becoming more and more common. You can't deny it. There's more energy in the atmosphere with our warmer climate, and it's putting more people at risk. And look at this. Yes, look at all these reports. 17 of them tornadoes. 362 wind reports. I mean, it's a threat to your safety. It's a threat to your health, too. I mean, when you have tornadoes, you have flying debris. You can get injured. Hello? So, I mean, yes, this is not a good thing. Moving on, real quickly, taking a look at today, you do have severe weather threats from portions of Texas straight on through to Georgia. So if you live in those areas, please stay safe and heed all warnings. Back to health now. Taking a look at the EMS situation in Philadelphia yesterday. It's not good. 887 EMS incidents. Again, every day since Monday has been above 800. I haven't been listening to the EMS calls. I think that's something I'm going to do tonight. Some people listen to music to put them to sleep. I listen to EMS calls sometimes. Why? Because I want to know and be informed of what's going on in my community. So 887, that's really high. Right now in Montgomery County, just 8 calls, but just before I started this recording, Chester County was busy. Yeah, it still is. It's a little busier than we've been seeing at this time of day. I'm seeing 1, 2, 3, 4, 5, 6, 7, 8, 9 calls right now. Chester County. I'm seeing a sick person a couple times, respiratory difficulty a couple times. We'll have to watch what's going on. I mean, right now we're not seeing a big surge in the United States, but other parts of the world are. The UK definitely has something going on. Japan, we know, has something going on right now, so we'll see. I don't think we're going to follow what's going on in the UK, but who knows? Here's Walgreens for this week. 14% COVID positivity rate, 12.6% the prior week. The difference is 1.3% up. Total test, 3,763 versus 3,941. We are seeing little slight increases here and there in some states with the positivity rate. Simply 4 cases, but we're also seeing testing going down. That combination could be why the Walgreens positivity rate continues to go up for a few weeks now. But again, we're at some of the lowest levels for the Walgreens positivity rate. I mean, 14%. The last time we were that low, you got to go all the way back to 2022. Taking a look at wastewater now, and we're going to take a look at something a little bit different today. We're going to go to wastewater scan for the national level, and I want to show you here. Look at wastewater scan on the national level. Not only has it started dropping again, it's dropped off a little bit faster. So wastewater scan on a nationwide level for COVID is not rising at this time. I stress, that is huge because the KP.2 variant, we know it is up and coming at this time. We'll get an update on it tomorrow. We're going to look at the previous level in just a moment. It's rising, and yet wastewater is still dropping. Come on, we need to take some positive news when we can get it. Is this going to last? I don't think so. I think it's going to last for the foreseeable future, at least I hope. I definitely think come after 4th of July, this is just my prediction. Maybe I will change it. I'm just throwing this out there. I think post 4th of July come summer, that could be when we see the next wave again, like we saw last year and, all times in the past. Moving down here, influenza. Nationally, it's not a big deal. HMPV, no. Norovirus is dropping at this time. And I do want to take a look at two individual wastewater sites just real quickly. We haven't looked at Harrisburg, Pennsylvania in a long time. What's going on there? Ever so slight rise for COVID. Disregard is high. It's low to moderate at best. RSV is low. Medium for influenza. That's probably closer to low. Influenza B is rising slightly. That was influenza A we talked about first. HMPV, slight rise. Norovirus is dropping. 2 detections of Mpox back in April, and a few hepatitis A detections at this time. Now let's go down south, shall we? And let's go down to the Atlanta area. How about we go over to Johns Creek, like northeast side of Atlanta? We don't usually take a look at this wastewater site. 84,000 population. COVID, it is rising slightly. Again, there are localized areas that are seeing rises, but on the national scale, it's just not happening yet. We hope it stays that way. Don't know. Eventually, at some point, it's going to change. Johns Creek, it is rising slightly. This is Roswell, Georgia. In case you are wondering, RSV is low at this time. Influenza A, it's saying medium. It did see a slight rise. Influenza B is starting to rise once again. HMPV, slight rise. Norovirus, not much issues. It says medium, but quite frankly, we'll call it medium. It's still dropping at this time. Mpox, there have been some detections. Hepatitis A, yes, definitely some detections of that. All right, moving on now. And we can see here, we're going to take a look at the KP.2 variant. Here's today's update. Well, not today's update, the previous update. And taking a look here, we can see here that the KP.2 variant back on April 27th was at 24.9%. JN.1 was then behind at 22%. We'll get a new update on this hopefully tomorrow. It's supposed to come in tomorrow. We'll see if it does as expected. Taking a look at New Jersey, 67 out of 70 hospitals reporting. Just 3 did not report, and New Jersey, after being, in a little slump for a while where it was bouncing around, actually, as KP.2 rises, New Jersey is actually seeing a drop. Now, obviously, there would be a few more hospitalizations if all 70 hospitals reported, but again, KP.2 on the rise, New Jersey hospitalizations dropping. 2 people on a ventilator, 16 in the ICU today, and discharges, 37. Taking a look at New York State, and I do need to refresh this particular metric. So New York State reported 632 cases today. Taking a look at New York State hospitalizations, this number dropped. 424 people in the hospital and 36 people in the ICU. All right, we have to move to another browser now. Why? We do have a few more states, and again, you're going to see the localized theme once again. There are little localized increases in some of these state updates. For example, taking a look here at Connecticut. Now, Connecticut's not, it says previous week 265, but last week when it was reported, we didn't see the full amount. Well, up to this point, I believe there was only 30-something cases of COVID. It's 58 at this point this week. Current week for RSV, 7. Current week for influenza, 112. Probably in the end result, wouldn't surprise me if it still ends up lower than last week. Now, speaking of a little increase in a localized area, Chicago is seeing one of them. And it shows here, hospitalizations. They're up ever so slightly. The daily average is 6.43. Hospital bed use is down. That's good. Emergency department visits are flat. Laboratory confirmed cases are up slightly. Previous week was 40. This week it's 44. Deaths are flat, and, well, not many people went out to get a booster or a vaccination. Just 305. Taking a look at what's going on in Massachusetts, 9.1% of all cases are 9.1% of all emergency department visits are currently for some sort of a respiratory virus. Influenza severity is low. COVID-19 emergency department visits are minimal. COVID-19 hospital admissions are low, and we want to do something a little bit differently here. Something we don't usually take a look at. Let's see, can we do this? Yes, I believe we can do this. It says here, during the week of April 28th through May 4th, 653 cases were recorded in the state of Massachusetts. All right, moving on now. This is the update for Washington. It's a pretty good update. Emergency department visits, flat. They're really low. Percentage of hospital admissions, really low. Just 1% for COVID. Less than 10 people in the ICU for COVID. Less than 10 people in the ICU for influenza at this time. Change from the prior week, it's not available. Yes, some really good numbers out of Washington. So that is good news. Tomorrow we will hopefully also have Los Angeles and California. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. We'll have another pandemic update again tomorrow. Let me know down below in the comments about that masking story that we read out of North Carolina. Are you concerned that masking could become banned in several different states? I'm definitely concerned about it. I mean, there's a lot of different reasons why they could go that route. Some that are not related to COVID whatsoever. I'll refrain from stating those reasons. Maybe if we do a rant, maybe I'll state those reasons tomorrow. But you get the idea here. It's sign of the times and interesting road going forward. Do whatever you can to keep yourself safe. One of those ways is subscribing down below so you stay informed. Give this video a thumbs up if you like the content. Of course, share this with anyone you know. Leave those comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Thursday evening. Thanks for watching.